Hi, in this video, let's talk about osteoarthritis. This is a topic under orthopedics where we are going to look at the pathophysiology or the disease process of osteoarthritis, go through what are the risk factors of this disease, and finally finish off with the management of this condition. Also, if you're watching this video, make sure that you like, make sure that you share, and please subscribe. In pathophysiology of osteoarthritis, we say that osteo means the bone, arthron means the joint, and itis is the inflammation part of that joint. So in definition, osteoarthritis, it is a progressive loss of articular cartilage due to wear and tear. Or in other words, this is a degenerative condition as a result of wear and tear of the articular cartilage. And so it means that we are not talking about all types of joints whenever we are talking about osteoarthritis. Because in classification of joints, we say that joints get classified according to their structure, according to the mobility, and according to their range of motion. And when we talk about structure, that is where now we talk about the articular cartilage. Let us call it AC. And when we talk about joints with articular cartilage, we are talking about synovial joints. And in order to understand the pathophysiology or the disease process of osteoarthritis in this case, let's now go down to look at the articular cartilage and its components to understand how this disease come about. So this structure that I've drawn in red, this one is the articular cartilage. The job of this articular cartilage is to keep these two bones in a joint separate from one another and allowing these two bones to glide against each other by eliminating friction. So that is the job of the articular cartilage, to allow two or more bones to glide against each other by eliminating friction. And so when we have osteoarthritis in this case, it means that the articular cartilage has been affected and these two bones are rubbing against each other because there is friction already, or these two bones are coming into contact with each other. From that point, let's now move in to look at what are these components of the articular cartilage that allow these two bones to glide against each other in longevity. Well, the articular cartilage has got two types of cells. We have got type A cells and we have got type B cells. For type A cells, what they do is that they fight cellular debris. And for type B cells, these are the cells that contain the components of the synovial fluid. And the synovial fluid, this is a lubricant that lubricate these articular surfaces. So these are the articular surfaces which get lubricated by this synovial fluid. Well, we cannot talk about the articular cartilage without talking about another special structure, and this structure gets called the chondrocytes, because what the chondrocytes do is that they take care of the articular cartilage. So they look after anything that could go wrong or could happen to this articular cartilage. So the main job of the chondrocytes is to take care of the articular cartilage. But how so? On the outer surface of these chondrocytes is a gel-like structure of the extracellular matrix, and this structure contain other components which are type 2 collagen and also osteoglycans. Type 2 collagen gives the joint what we call stability of the joint. And with stability, it means that the joint can therefore bear weight. So these two structures, or these two components, the type 2 collagen and osteoglycans, are good friends. And whenever they interact, what they offer the joint, it is elasticity plus high tensile strength. Well, but that doesn't end there, because these chondrocytes ensure that the articular cartilage is in good shape and it is well maintained by playing something we call a delicate balance, or there is a balancing act that is happening within the joint, and it occurs through two activities. And these two activities, one is called the anabolic activity, and the other one gets called the catabolic activity. What these two activities involve: for anabolic activity, it ensures that there is formation of new articular cartilage. So there is formation of new articular cartilage. But for catabolic activities, it means that there is breakdown of old articular cartilage. And that is to mean that the chondrocytes work in making sure that the articular cartilage is in good shape by doing away with old articular cartilage and formation of new articular cartilage. But over time, something could happen to the joint, and this can cause the catabolic activities to overpower anabolic activities. So anabolic activities are made possible by the enzymes we call synthetic enzymes. But catabolic activities, the enzymes responsible for these activities are called degenerative enzymes. So what is that could go wrong to cause the catabolic activities to overpower anabolic activities? We are going to talk about that once we reach there at the risk factors. But look here. If the catabolic activities are more or are overpowering the anabolic activities, it means what? It means that this tip of the balance will tip towards which side? It will mean that this tip is going to tip this way, because the catabolic activities or the degenerative enzymes are overpowering the synthetic enzymes, and so the catabolic activities exceed the anabolic activities. Well, because of that, and when the breakdown of old articular cartilage is overpowering the making of new articular cartilage, you see the type 2 collagen that was being formed by the chondrocytes and the osteoglycans, it ends up making type 1 collagen, which doesn't interact in the right manner with the osteoglycans. And if the job of type 2 collagen and osteoglycans is to add elasticity and to give structural support to the joint, what does that mean? It means that type 1 collagen and osteoglycans, once they interact, the joints start losing elasticity. Well, over time, the bone or the joint cannot keep up through these catabolic activities and anabolic activities. And when the catabolic activities are overpowering anabolic activities, what happens over the years is that the articular cartilage degenerates through apoptosis, which is a programmed cell death. So the articular cartilage is going to die through the process of apoptosis, and from there, because of this erosion, the bones that are making up a joint, they start making contact with each other, and the joint space that was there starts reducing. Well, you could be asking yourself, because we talked about type A cells of the articular cartilage, which their job is to fight off cellular debris that could be attacking the articular cartilage, how come they are not helping? Look, because of erosion that is happening within the articular cartilage, these fragments of the articular cartilage which came about because of this erosion, they start flaking off inside the joint space. So this is the joint space here. And these fragments start falling off here, and they get called joint mice. Well, the job of type A cells of the articular cartilage is to fight off any cellular debris. Obviously, they could be trying to attack these joint mice that are falling off inside the joint space, but they are unable. Why? Because right here, there is something that is called a synovial membrane, and the pro-inflammatories like the cytokines and the macrophages, if they try to attack these joint mice, they are blocked by this synovial membrane. And if this happens, these macrophages and cytokines, they start eating up this synovial membrane. And whatever follows is something that we call synovitis, which is the inflammation part of the disease, osteoarthritis. Something else happens. The articular cartilage that is getting eroded start having something like a crack. And these cracks are called joint ebanation. And that is how down these cascades the disease osteoarthritis is born. Now, because we talked about the pathophysiology of osteoarthritis, let's now go further to look at what are these factors that could lead to the catabolic activities overpowering the anabolic activities. Let's now talk about the risk factors. When we talk about the risk factors of osteoarthritis, they are classified into two. They are modifiable factors and non-modifiable factors. For modifiable, it means that these are the factors that can be corrected. For non-modifiable, these are factors that cannot be corrected. Well, for modifiable factors, we are talking about something like obesity, weight, And we also have got trauma. For non-modifiable factors that cannot be corrected, we are talking about things like age, gender, and genetics. And here I mean osteoarthritis mostly targets the elderly, female gender, and a positive family history of osteoarthritis. Let's now talk about the diagnosis of osteoarthritis. Osteoarthritis is typically a clinical diagnosis, and during clinical assessment, these are the things to look out for. One is pain, and this pain that we are talking about, it is chronic pain, which gets exacerbated by overuse and gets alleviated by rest. Something else to look at for is joint stiffness, which is mostly during the morning hours and doesn't go more than 30 minutes. Something else to look out for, it is limited joint mobility. That is it. Plain radiographs are the typical modality in diagnosis of osteoarthritis. In interpretation of X-rays, these are factors to consider. We normally use the mnemonic loss, which means that there is lost joint space because the articular cartilage has eroded and these two bones are coming into contact with each other. For O, it means that there is formation of osteophytes. And osteophytes, these are bone spurs that are forming at the end of these two bones that are coming into contact with each other. For S, it means subarticular sclerosis. And what this means basically is that there is increased density at these areas of the bones where they are coming into contact with each other. For this S again, it means there is subchondral cyst. And subchondral cyst, what it means is that these are fluid-filled spaces within the bone. Let's now get to understand how osteoarthritis is managed. There are different ways to go about the management of osteoarthritis. Let's first talk about the non-pharmacological way. Because we said that osteoarthritis, the main causes are weight plus obesity, it therefore means that for non-pharmacological treatment, weight loss plus exercises are key in managing this disease. Something else to add on to that, it is physical therapy. Or even occupational therapy. For pharmacological treatment, we are talking about which medications. First of all, we are talking about NSAIDs because NSAIDs are very important, or they are very essential in fighting off inflammation plus pain. And in this case, it means that we are utilizing per-oral NSAIDs as well as topical NSAIDs. Other medications are acetaminophen, ibuprofen, which also act as analgesics. NSAIDs are contraindicated for patients who have got gastric ulcers or peptic ulcer disease. Why is that? Long-term use of NSAIDs, what happens is that these drugs, they inhibit the action of special enzymes that we call KOX, or the cyclooxygenase type 1 and type 2. So KOX1 and KOX2. And once they get inhibited, they cannot synthesize chemical messengers that we call prostaglandins. And these prostaglandins are very essential as they are the ones that do away with pain plus inflammation. And if long-term use of NSAIDs block the action of this KOX, it means that the KOX cannot synthesize prostaglandins, and thus it means inflammation will be there, and for peptic ulcer disease, this patient will have an increased risk of inflammation to the gastric mucosa. So watch out for that one. Well, let's say that this disease has progressed further to a point that both the pharmacological and non-pharmacological management methods cannot work. And in this case, we go the third route, which is the surgical way. And in surgical way, it means that there will be something like arthroscopy or joint replacement. So, will it be necessary if we talked about which are the most targeted joints when it comes to osteoarthritis? Yes. These joints are of the hands, the knee joint, the hip joint, not forgetting the sacroiliac joint. Okay guys, that was all for today. We talked about osteoarthritis, whereby we went through the pathophysiology of this disease, getting to know which are these cascades that lead to the disease process. If this video was helpful, make sure that you like, make sure that you share, and please subscribe.